The skeleton. Part A. 7. 80 bones segregated into 3 regions. The axial skeleton. 80 bones segregated into 3 regions. Skull. Vertebral column. Bony thorax. The skull. The skull, the body's most complex bony structure, is formed by the cranium and facial bones. Cranium protects the brain and is the site of attachment for head and neck muscles. Facial bones supply the framework of the face, the sense organs, and the teeth. Provide openings for the passage of air and food. Anchor the facial muscles of expression. Cranial bones are thin and remarkably strong for their weight. Anatomy of the cranium. 8 cranial bones, 2 parietal, 2 temporal, frontal, occipital, sphenoid, and ethmoid. Cranial bones are thin and remarkably strong for their weight. Forms the anterior portion of the cranium. Frontal bone. Forms the anterior portion of the cranium. Articulates posteriorly with the parietal bones via the coronal suture. Major markings include the supraorbital margins, the anterior cranial fossa, and the frontal sinuses, internal and lateral to the glabella. Skull, anterior view. Figure 7.2a. Skull, posterior view. Figure 7.2b. Parietal bones and major associated sutures. Form most of the superior and lateral aspects of the skull. Figure 7.3a. Parietal bones and major associated sutures. 4 sutures mark the articulations of the parietal bones. Coronal suture, articulation between parietal bones and frontal bone anteriorly. Sagittal suture, where right and left parietal bones meet superiorly. Lambdoid suture, where parietal bones meet the occipital bone posteriorly. Squamosal or squamous suture, where parietal and temporal bones meet, occipital bone and its major markings. Forms most of skull's posterior wall and base. Major markings include the posterior cranial fossa, foramen magnum, occipital condyles, and the hypoglossal canal. Figure 7.2b. Occipital bone and its major markings. Figure 7.4b. Temporal bones. Form the inferolateral aspects of the skull and parts of the cranial floor. Divided into 4 major regions: squamous, tympanic, mastoid, and petrous. Major markings include the zygomatic, styloid, and mastoid processes, and the mandibular and middle cranial fossae. Major openings include the stylomastoid and jugular foramina, the external and internal auditory meatuses, and the carotid canal. Temporal bones. Figure 7.5. Sphenoid bone. Butterfly-shaped bone that spans the width of the middle cranial fossa. Forms the central wedge that articulates with all other cranial bones. Consists of a central body, greater wings, lesser wings, and pterygoid processes. Major markings: the sella turcica, hypophyseal fossa, and the pterygoid processes. Major openings include the foramina rotundum, oval, and spinosum, the optic canals, and the superior orbital fissure. Sphenoid bone. Figure 7.6a, b. Forms most of the bony area between the nasal cavity and the orbits. Ethmoid bone. Most deep of the skull bones, lies between the sphenoid and nasal bones. Forms most of the bony area between the nasal cavity and the orbits. Major markings include the cribriform plate, cristogalli, perpendicular plate, nasal conchae, and the ethmoid sinuses. Ethmoid bone. Figure 7.7. Tiny irregularly shaped bones that appear within sutures. Wormian bones. Tiny irregularly shaped bones that appear within sutures. 14 bones of which only the mandible and vomer are unpaired. Facial bones. 14 bones of which only the mandible and vomer are unpaired. The paired bones are the maxillae, zygomatics, nasals, lacrimals, palatines, and inferior conchae. Mandible and its markings. The mandible, lower jaw bone, is the largest, strongest bone of the face. Its major markings include the coronoid process, mandibular condyle, the alveolar margin, and the mandibular and mental foramina. Mandible and its markings. Figure 7.8a. Maxillary bones. Medially fused bones that make up the upper jaw and the central portion of the facial skeleton. Facial keystone bones that articulate with all other facial bones except the mandible. Their major markings include palatine, frontal, and zygomatic processes, the alveolar margins, inferior orbital fissure, and the maxillary sinuses. Maxillary bone. Figure 7.8b. Zygomatic bones. Irregularly shaped bones, cheekbones, that form the prominences of the cheeks and the inferolateral margins of the orbits. Other facial bones. Nasal bones, thin medially fused bones that form the bridge of the nose. Lacrimal bones, contribute to the medial walls of the orbit and contain a deep groove called the lacrimal fossa that houses the lacrimal sac. Palatine bones, two bone plates that form portions of the hard palate, the posterolateral walls of the nasal cavity, and a small part of the orbits. Vomer, plough-shaped bone that forms part of the nasal septum. Other facial bones. Vomer, plough-shaped bone that forms part of the nasal septum. Inferior nasal conchae, paired, curved bones in the nasal cavity that form part of the lateral walls of the nasal cavity. Anterior aspects of the skull. Figure 7.2a. Posterior aspects of the skull. Figure 7.2b. External lateral aspects of the skull. Figure 7.3a. Mid-sagittal lateral aspects of the skull. Figure 7.3b. Inferior portion of the skull. Figure 7.4a.